Hey, good morning and welcome to the UroPatient Podcast. I'm your host, Vic Senese. Glad to have you on board. If you're watching us live, you can watch us on Facebook, LinkedIn, X, what am I forgetting? YouTube and Kick. All of those are coming to you live at the same time every Saturday morning at 10:30 a.m. Central Time. If this is your first time checking us out, be sure to go to our website at uropatient.com, the best place to learn more about us. That's the best place to see more information and all of our past episodes. Boy, we got a bunch of them. So check out all of those past episodes for something you might have missed. Also, we've got these helpful information handouts that I put together. You can go there free of charge. Just copy them and take them with you to your doctor's appointment or just have them as a reference. They're yours. Go ahead and get those. Hey, we've got a great episode for you today. Be sure to always join us every week. And here we go. Today, we're diving into a surprising topic, how medications like Viagra and Cialis, typically used to treat erectile dysfunction, might also benefit your heart. Many don't know that these drugs were initially developed for heart conditions. They help blood vessels relax, improving blood flow, which turns out to have multiple effects on the body. Interesting story. In the late 1980s and early 90s, scientists at Pfizer were researching a new drug to treat angina pectoris, which is chest pain caused by reduced blood flow to the heart. They were developing a compound called sildenafil citrate, which worked by relaxing blood vessels to improve blood flow. Now, the theory being that it would help relieve chest pain by increasing oxygen supply to the heart. Now, clinical trials revealed an unexpected effect. During the early clinical trials in South Wales, the drug wasn't very effective for chest pain at all. But researchers noticed a surprising side effect. Many of the male participants reported improved erections. When the researchers asked participants to return their unused pills, many refused. That was the big clue. So the shift to erectile dysfunction, realizing the potential, Pfizer pivoted. They began conducting focus studies on men with erectile dysfunction. Now, the results were remarkable. It was the first oral treatment that was effective, fast-acting, and well-tolerated. These medications improve circulation by enhancing nitric oxide effects. This is a key in erectile dysfunction, but it also supports cardiovascular health. Who knew? Large studies out of Sweden and Germany showed these drugs may improve survival in men with heart disease. In Sweden, the Karolinska Institute study in 2017 and updated in 2022, lead researchers Dr. Daniel Peter Anderson and his colleagues from the Karolinska Institute had a study focus. Men who had experienced a first heart attack, we call myocardial infarction. What did they find? Well, men prescribed PDE5 inhibitors, that's your Viagra, after a heart attack had a 33 to 39% lower risk of death from any cause compared to those who didn't take these drugs. It also showed lower rates of rehospitalization for heart failure. So, what's this all mean? Well, it suggests that the PDE5 inhibitors may have a cardioprotective effect. Let that sink in. Not just improving sexual function. There was another study in Germany called the Leipzig Heart Study from 2014 to 2021 at the University of Leipzig Heart Center in men with type 2 diabetes and stable coronary artery disease. Those taking PDE5 inhibitors had significantly lower all-cause mortality. They also showed better heart function by improving ejection fraction. What's all this mean? Well, PDE5 inhibitors, drugs like Viagra, may reduce systemic inflammation. That's the key word there. By improving endothelial function and reduce cardiac remodeling. Now, those are fancy words for meaning that what lines the inside of blood vessels was getting back to being slippery like it should be. A reminder now, these aren't small numbers. These benefits might actually change how we think about these medications in men's health. They do more than improve your love life, which they do. Many people assume these medications only affect one part of the body, but when you take a pill, it actually benefits the whole body and, more importantly, your whole vascular system. You have this endothelial stuff throughout your system. They improve how blood vessels function, they enhance circulation, and reduce pressure in the heart and lungs. These are serious cardiovascular benefits. Can't rub that in enough, and they're being studied more and more. Most side effects are mild and temporary, like headaches or flushing. However, it's important to always review your medications with your provider. Now, never combine drugs like Viagra with nitrates or alpha blockers unless you're advised, as they can cause dangerous drops in your blood pressure. It's to the point that you pass out, and you could get injured from that. So who should not take Viagra or similar type ED drugs? So again, people taking nitroglycerin, you take it because you have a heart issue and you take it for the chest pain relief. That's out. You can't take it. Those with recent serious heart or liver conditions like a heart attack, stroke, unstable angina, severe heart failure, because sexual activity and medication may increase the risk. Surprisingly, most of the time they find that as long as you can walk up a flight of stairs, you're probably about the same amount of activity that most sex would have. People with very low blood pressure. So if you've got one of these guys that's running kind of low, like under 90 millimeters, that's that top number, systolic number, these drugs can lower your pressure even more. And again, you stand up and your pressure may drop to the point that you pass out. Dangerous. Individuals with a really, really rare genetic disease called retinitis pigmentosa, because of some vision issues, cannot take those drugs. And of course, I guess if you're allergic to the drugs, you'd avoid them anyway. Now, if you're taking alpha blockers, which are typically used to treat prostate problems, or sometimes blood pressure, but mostly prostate, you got to use them with caution because, again, those also lower the blood pressure. So you've got two drugs lowering blood pressure, so you got to make sure that the doc's aware that you've got two drugs. Good news. One of these drugs, called Cialis or tadalafil, can be used for BPH, like the alpha blockers, your prostate, and that effect would be probably better than taking that on top of something like an alpha blocker as far as your blood pressure goes. So lots of options out there. Now, if you have severe kidney or liver problems, you have to use them with care. Having bleeding disorders or active stomach ulcers, again, using it with care. Now, this is one of my favorite shows. It's called Mythbusters, and those are the AI-generated pictures of the two guys from Mythbusters. Now, let's bust some common myths about erectile dysfunction medications. Many people think these drugs are only for improving sexual performance or intimacy. But again, research has shown now they may offer significant benefits beyond that. So originally developed to help heart-related chest pain, remember what they were originally developed for, these medications, as I said, work by relaxing blood vessels and improving blood flow throughout the body, not just the penis. This improved circulation can have a positive effect on your whole entire cardiovascular system as a whole. So studies have found that men using these medications are experiencing a lower risk of heart attacks. Bust that myth. They're more than just erectile pills. Better blood vessel health, and improved survival rates after heart-related events. So these drugs might actually protect your heart while helping you keep it up. Now, these meds help. They don't just replace a healthy lifestyle. You still need to take care of your body. You know, everybody wants the easy way out, right? Take a pill and look like that guy, but it doesn't work that way. We talked about this in some of my past episodes, the importance of exercising. I can't stress that enough. I work out every day myself, take a bike ride. So whatever you're doing, keep that up, or if you're not doing it, start doing it. So it's exciting to share that ongoing research is investigating how these medications known for treating erectile dysfunction might also protect the heart. Some studies show that improving reduced heart attacks, strokes, and improved heart failure symptoms. However, results may depend on your condition, your heart condition, and more research is definitely needed before doctors will start prescribing them probably specifically for heart health. But if you're taking them, you know, I always say if you need a drug like Viagra to help with your erectile dysfunction, maybe you might want to consider that daily pill called tadalafil or Cialis. You're taking a slightly lower dose, but it works just as well for the erections, helps your prostate, and who knew, helps your heart. So be sure to subscribe and follow us for weekly updates and expert insights. Thanks again for being here today, and we'll see everybody next week on UroPatient Podcast.